Hi, my name is Jasmin Henry, and I'll be talking to you today about bipolar disorder and its effects on the quality of life of its sufferers. Um, Despite the variety of treatments for this disorder, it continues to be a chronically relapsing condition. It's basically a life sentence, and there is about a 15 to 20% suicide rate for this disorder. According to the World Health Organization, it's actually the sixth leading cause of disability, and according to the National Institute for Mental Health, it affects around 2.6% of the population, age 18 and older, um, and that's 18 and older. There is early onset bipolar that affects children. So there's that. Um, Bipolar itself, though, results in an average reduction of the patient's lifespan of for about 9 years, but it can actually be as high as 20. This is usually because 1 in 5 patients will complete suicide, but also because patients don't make the best life choices. So they're about twice as likely to get cardiovascular diseases, COPD, diabetes type 2, leading to complications and death. Personally, I've struggled with this disorder since the age of 19. I wasn't officially diagnosed yet, though, until last year when I was 23, and I'm still 23. I'm going on 24 in a few months here. I was diagnosed incorrectly for several years, and I was given a lot of medications that were not for bipolar. The thing with those is that if you give a bipolar person certain medications, it can trigger certain symptoms. So, as you can imagine, I had several bad reactions to medications. But now that I have my correct diagnosis, and I'm on the correct medication, I've noticed a stabilization of my symptoms, but my quality of life is certainly not what it once was. And this disorder continues to affect everything in my life. So that brings me to my point, which is that bipolar disorder severely impacts all aspects of a sufferer's life, and those around them. It often diminishes quality of life, specifically concerning the workplace and relationships. So in this speech, I will touch on the signs and symptoms of bipolar disorder, the effects that these symptoms have on people's lives, and resources for help treatment options, and such. And I mean, usually when you think of bipolar, you think of crazy people. A lot of people are always like, "Oh, I'm so bipolar because I change my mind all the time," and nothing could be further from the truth, honestly. Stuff like that really is detrimental to the image of what bipolar really is. People think it's just mood swings, or it's it's something that you can control. You're just being a brat. It's so much more than that. It's nothing I can help. It's nothing that other people can help. It's an actual illness. It's not just being a little bit sick sometimes, or I can't put it on hold for school or work or parenting. So, according to the National Institute of Mental Health, bipolar disorder is defined as a brain disorder that causes unusual shifts in mood, energy, and activity levels, and the ability to carry out day-to-day tasks. So these shifts in mood can vary from depressive episodes, which can be so bad that they leave you bedridden for weeks. Usually at least 2 weeks, you just don't want to get out of bed. And if you do manage to get out of bed, people can tell that you're depressed. It can be really bad. That was usually my problem. When I was stationed in Korea, particularly, I would just my weekends, I mean, I was living in Seoul, South Korea. I could have done anything. I was 19. I was of legal drinking age over there. I was in this amazing city, and on weekends, I stayed in bed. I stayed in bed and I did not get out for anything to eat, to bathe. I only ever left bed if the urge to go to the bathroom got so bad that I knew I was going to soil myself. And that's how you know that that's not normal. A 19-year-old in a foreign country should be out exploring. On the opposite spectrum of that, you may have what's known as mania or hypomania, which is a significant increase in an elevation in your mood. Depending on the severity, you may have psychosis with that. That's more of the mania part, though. Hypomania tends to not have psychosis. With mania, you'll be abnormally happy, energetic, even irritable. You'll think you have special powers. Um, you'll want to buy everything. Having a lot of sex. It's crazy. People will definitely notice there's something off. Hypomania is usually a little less crazy. Some people call it mini mania. It's a milder form of mania. It lasts about 4 days minimum, but it can go on to a few weeks if untreated. And it doesn't usually impact your ability to function in the workplace or socialize or anything like that, as full-blown mania would. And most people tend to notice that something's a little different, but it's not like mania where you're like on top of the roof screaming with your head shaven. It also, as I said, does not have psychotic features and does not require hospitalization. Hypomanic episodes, they usually come with increased productivity, so people will find themselves doing better at work, they're doing more. Therefore, a lot of people enjoy their hypomania, but some people, that hypomania comes to them at the cost of irritability and poor judgment. There is a third type of episode, which is not very well known. Most people think of bipolar as like really depressed and really happy, and it's actually there's a middle. It's called a mixed episode, and it's exactly what it sounds like. It's mania and depression at the same time. And this is especially dangerous because if you are thinking that you can do anything and you have special powers and you can fly, but at the same time you're very suicidal, you could end up jumping off a roof, and killing yourself or something like that. And that's usually a really high-risk state. It does require hospitalization. In fact, when you go in for evaluations and stuff like that, they ask you stuff like, have you ever thought you had special powers or something, and that's usually what they were referring to. And now, I'm going on about the spectrum of bipolar. A little known fact about bipolar is that it's not the same across the board. You can't just say, oh, I'm bipolar, and then the person next to you is also bipolar, and you guys have the same kind of situation going on. There are types of bipolar. The first one is bipolar 1. It's defined by manic episodes lasting at least 7 days, or by any manic symptom that is so severe that it requires immediate hospitalization. Depressive episodes can occur, but they're not necessary to make the diagnosis. There's also the possibility for mixed episodes. There's specifiers, like from mild all the way to severe, and with psychotic features as well. The next one is bipolar 2 disorder, and that's the one that I have. It's defined by a pattern of depressive episodes, which tend to be the prevalent mood, and hypomanic episodes. There is never full-blown mania, however. Due to the lack of full mania, this makes type 2 very hard to diagnose because patients don't often report hypomania. I know I never did, and that's why it took me so long to get diagnosed. Hypomania is a little harder to identify. I just kind of thought I was inspired sometimes. My hypomanias, I'm the type of people that I don't gain very much from my hypomanias. Mine do come at a cost of poor judgment and irritability. When I do start being productive, it's usually not for things that I would like to be productive in. I don't become more productive at work or at school. I do things like I go out and I spend $200 on clay, and I sculpt and sculpt and sculpt, and I don't like sculpting, but there I am at 3 in the morning sculpting. And then once I come out of this hypomania, I'm angry because I just spent so much money on all of this stuff, and now I don't want it. But that's the nature of bipolar. The third type is cyclothymia. It's defined by a history of hypomanic episodes and periods of depression that do not meet criteria for major depressive episodes. Okay, There's also the subject of how fast these changes can occur. There's no set like timer in your brain that can make these happen. They don't. It's not like a time of day or like it, like every couple. No, it varies from person to person. I'm what they call rapid cycling, which means I have 4 or more mood disturbance periods within a 1 year span. I tend to be on the more than 4 type of deal, and mine do last quite a bit of time. But now that I'm on medication, they are not as severe as they used to be. They're definitely there, but as opposed to being bedridden with depression, I'm just very sad and unproductive, which doesn't sound like a big improvement, but I'd rather be out of bed and at least forcing myself to go to work than in bed and just crying all day. There are variations as well where people can transition as fast as every couple of weeks, or even days, or even within a day, but those are kind of rare. Now, management of bipolar disorder is very important because there is no cure. They do have medications such as anticonvulsants, some of which have mood stabilizing properties. I am on Divalproex, otherwise known as Depakote. It's an anticonvulsant, which means anti-seizure medication, that has mood stabilizing properties. It also smells like cake. Fun fact. And I take it 3 times a day. And I have to have my liver checked every couple of months through blood draws, because these medications are very heavy on the liver, unfortunately, and I do have a pre-existing liver condition, so this is something of a concern as a patient, and we're just kind of keeping an eye on it, because if something were to happen, I would have to go off of this medication, and this is literally life-saving to me, so it's important that I keep up with these blood draws. They can also use atypical antipsychotics and antidepressants for the various symptoms of bipolar. There's also psychotherapy and psychoeducation. That's just more like talk therapy, sitting down, going over learning coping skills and mechanisms. And the psychoeducation part is just educating the patient population as to what their disorder means and all that. I have the advantage of having been a medic. I understand a lot of the literature that is out there that is meant for providers. So I have a deeper insight into the disorder because I have a medical background, which makes it a little bit easier to cope with the fact that I have this disorder that I can't get rid of. For individuals with severe bipolar that have not found any relief with the traditional methods, there's electroconvulsive therapy, but that's kind of a really last resort. But the thing to remember is that even with proper management, mood changes can and will still occur. There's no way around it. The medication is not perfect. Therapy is not perfect. There is something wrong with the chemicals in your brain, and you can only manage it. Moving on from the medications and the management, we transition into effects on the quality of life, because that's directly tied. How well you manage it or don't manage it, affects how you can live your life. So we first have to look at the symptoms in detail. So for mania, there's you can feel jumpy, wired, difficulty sleeping, and you feel rested after only a few hours. You're more active than usual. You talk really fast, and you're just really pressured, like you just want to finish what you're saying. You're agitated, irritable, like your thoughts are just racing. You can't grab a hold of them. You think you can do a lot of things, doing risky things. Psychosis. For hypomania, there's also decreased need for sleep, feeling rested after little sleep, extremely outgoing or competitive, more energy than usual, but still being able to fully function. Increased productivity, pressured speech, inflated self-esteem, racing thoughts again, easy distraction, often mimicking ADHD, moving from one activity to the next and doing multiple activities at a time, agitation, irritability, hypersexuality. All this lasts at least 4 days. yet with lesser impact on your functioning than mania. Depression is your typical depression symptoms: sadness, irritability, anger, loss of enjoyment of activities, changes in weight and appetite, difficulty concentrating, thoughts of death or suicide. There can be psychosis, delusions, or hallucinations, and usually these episodes of depression last about 2 weeks minimum. Now, according to a 2005 study by the International Journal of Psychiatry and Neurosciences, bipolar patients experience lower functioning and well-being even in the stable phase of the disorder, meaning that even if you're not depressed, hypomanic, or manic, or mixed, you will still have a lower quality of life in general. And this is because of the neuropsychological difficulties that come with this disorder in the form of cognitive impairments, and these usually get overlooked during treatment because providers want to treat the mood-related symptoms. Because there's this idea, even within the mental health community, that bipolar is simply a mood focused disorder. It is a mood disorder, but there is more to it than the mood symptoms. These impairments are similar to those that individuals with Alzheimer's exhibit, albeit to a lesser extreme, but they're there and they disrupt people's lives. According to the Psychiatric Times, neuropsychological functioning is not a unitary process and consists of multiple partially dissociable cognitive domains, such as attention, processing speed, working or declarative memory, executive processing, language, intelligent quotient. Those euthmic patients with bipolar disorder who have cognitive difficulties tend to have attentional, executive, and declarative or long-term memory impairments. What this means is that patients have difficulties with planning activities, maintaining those plans. Like me, I have a really hard time keeping up with my schedules for anything. I could say, next Tuesday, I have to go get a haircut. Tomorrow, that could be wiped completely clean from my mind and I would have no idea. What the things I have to do at this point with my level of cognitive impairment at 23 years old is, as soon as I have an appointment, I have to write it down. I have to take a picture of it. I send the picture to my boyfriend and I keep the sheet that I wrote it on, and he has to, we have a big calendar and he writes my stuff on there. He also puts it on his phone. He has become at this point my part-time caretaker. He reminds me to take my medication because my alarm goes off sometimes for it, and I look at it, I turn it off, and then I immediately forget that I need to take my medication. But he has the alarms on his phone too, and he will come up to me and he says, "Have you taken your meds?" And I usually look at him blank face, and he's like, "Okay, you did not." So I've lost a lot of my independence to this disorder. I also have a lot of trouble with retaining things I've read. Word retrieval. You notice I say a lot, and that's not due to being nervous. It's just that a lot of the time I don't know what word I want, and it takes me a little bit to figure out which word is the word that I'm trying to use, and that's also why I have a lot of pauses in my speech, and that's actually really embarrassing when I'm talking to peers or patients, because I know what I want to say, I just don't know which word to use. And so I tend to be very quiet in social situations because I just don't want people to notice. It's noticeable. It's getting to be noticeable. And who wants to call attention to themselves in that respect when they are this young? There's been research that says that the use of psychiatric medication can also contribute to this decline in neuropsychological functioning. But this research has been limited, which is a shame, because that could also help us find new medications that maybe have better effects on that in that respect, while maintaining the level of functioning related to the mood stabilization. There was a study from the Netherlands which compared the SF-36 scores. The SF-36 is the most widely used quality of life measure in bipolar population to date. Compare the scores with the scores found in patients with a variety of other psychiatric disorders. So in the domain of mental health, bipolar patients scored only 62.3%. Those with anxiety scored 74. Those with no psychiatric disorder scored 85.8. So in conclusion, bipolar disorder is more than just mood swings here and there. It is not getting sick sometimes. It is not being a brat, being moody, being bitchy. It's not something you can just put on pause for the sake of school or work or life, parenting. It doesn't matter what gets in the way. You can't help it. It's a disorder. It takes over your life and affects everything in it and the people around you. For me, personally, it makes everything difficult. I can't remember to do simple tasks sometimes. I found it difficult to hold down a job, and I honestly live in fear that I'm going to be let go from the one I currently have for poor performance. It's turned me, a 23-year-old former active duty medic who ran an entire clinic, into this halfway independent person, and it's turned my 24-year-old boyfriend, who's a full-time college student, into a part-time caretaker when he should not be. And so despite these various medication and therapies available for this disorder, it generally continues to be a life sentence. That's what it is. I've experienced symptoms here and there for years, probably since my early teens, but it's always had been pinned down to me being a difficult child. My 4 years in the Army got progressively more and more difficult as my disorder became more prevalent. And like I mentioned this before, I was wrongly diagnosed several times while in active duty, and I'm kind of glad a little bit that I did not get diagnosed while active duty, because they would have kicked me out. I didn't even get a correct diagnosis until over a year after I was out of the military. My level of functioning was so bad at that point. My mind was in such disarray with my racing thoughts and all that. They thought I was schizophrenic. That's why they sent me for evaluation. It was that bad. So that's how bad bipolar can get. So this is why I believe education of the public is important in the treatment and furthering of advancements in research of this disorder. I really believe that the more we educate people, the more donations we can expect for research funding that will hopefully lead to new discoveries in medication and therapies. And through this, one day patients with this disorder can enjoy a higher quality of life, a quality of life similar to those around them without bipolar disorder. Education also eliminates misconceptions about this disorder and the stigmas that may stem from said misconceptions. It's hard enough to live with mental illness and both the decreased life expectancy and quality of life without adding to it the judgment faced daily. Daily. I didn't choose to be sick, but I'm choosing to be an advocate for my illness.